The warm embrace of the sun is a welcome sight, but for those taking certain medications, it can quickly turn into a potential hazard. In this video, we will explore the top 10 medications that necessitate caution when it comes to exposure to sunlight in the United States. These medications, ranging from antibiotics to psychotropics, can increase skin sensitivity to harmful UV rays, potentially leading to sunburn, rashes, and other adverse effects. Disclaimer: please be aware that the content presented in this video is meant solely for educational purposes. It should not be considered a replacement for expert medical advice, diagnosis, or treatment. Whenever you have inquiries related to a medical condition, it is crucial to consult a qualified healthcare professional. Please do not disregard professional medical advice or postpone in seeking it based on information you have come across in this video. Number 10. Tetracycline antibiotics. Tetracycline antibiotics, including doxycycline and minocycline, are extensively used to combat various bacterial infections. Their downside, however, is their propensity to cause photosensitivity, making the skin more susceptible to UV damage. A 2009 study in the Journal of American Academy of Dermatology found that these antibiotics significantly increase the risk of sunburn. Typical adult dosages for doxycycline are 100 mg twice daily and for minocycline, 100 mg once daily. These antibiotics should be taken with a full glass of water and should not be followed by lying down for at least 30 minutes. Dosing intervals usually involve taking them once or twice daily as directed by a healthcare provider. Common side effects encompass nausea, vomiting, diarrhea, and skin rashes, which can be exacerbated by excessive sun exposure. 9. Isotretinoin. Isotretinoin is a potent remedy for severe acne. Nevertheless, it comes with a side effect of increased skin fragility and heightened sun sensitivity. A 2018 study published in the Journal of Dermatological Treatment disclosed that isotretinoin can lead to significant sunburn and UV damage. The typical starting dose for isotretinoin is 0.5 mg per kilogram per day, with a maximum daily dose of 1 mg per kilogram. This medication is best taken with food to improve absorption and minimize stomach discomfort. The dosing interval usually involves once daily administration. Side effects encompass dry skin, chapped lips, and increased sensitivity to sunlight, which can lead to sunburn and skin rashes. 8. Methotrexate. Methotrexate is often prescribed for autoimmune diseases such as rheumatoid arthritis and psoriasis. Regrettably, it can increase the risk of sunburn due to its impact on skin cells. A 2015 study published in the Journal of Investigative Dermatology corroborated that methotrexate can exacerbate UV-induced skin damage. Adult dosage typically range from 7.5 to 20 mg per week, contingent upon the condition being treated. Methotrexate is typically taken as a single weekly dose with or without food, as advised by your healthcare provider. Common side effects include nausea, fatigue, and increased sun sensitivity, leading to sunburn. 7. Amiodarone. Amiodarone, a medication used to treat certain heart rhythm disorders, can result in amiodarone-induced photosensitivity, making your skin more susceptible to UV rays. A clinical study from 2013 published in the Journal of Pharmacy Practice highlighted the potential of amiodarone to induce photosensitivity in a significant number of patients. Adult dosages of amiodarone can vary but often begin with 800 to 1,600 mg per day for the first week, followed by a maintenance dose of 600 to 800 mg daily. This medication is generally taken with meals to enhance absorption. The dosing interval typically involves splitting the daily dose into 2 administrations. Common side effects include sun sensitivity leading to sunburn and skin rashes, along with thyroid dysfunction and potential lung issues. 6. Non-steroidal anti-inflammatory drugs or NSAIDs. NSAIDs like ibuprofen and naproxen are commonly used for pain relief and to combat inflammation. However, their anti-inflammatory properties can make the skin more prone to sunburn due to increased sun sensitivity. A study published in the Journal of the American Academy of Dermatology in 2004 affirmed that NSAIDs can exacerbate the effects of UV radiation. Typical adult dosages include 200 to 400 mg of ibuprofen every 4 to 6 hours and 250 to 500 mg of naproxen every 12 hours. These medications are best taken with food to mitigate stomach irritation, and dosing intervals usually involve taking them every 4 to 6 hours, or as directed by a healthcare provider. Common side effects encompass increased sun sensitivity, gastrointestinal issues, and an elevated risk of bleeding. 5. Quinolone antibiotics. Quinolone antibiotics such as ciprofloxacin and levofloxacin are prescribed for a variety of bacterial infections. Unfortunately, these antibiotics can increase the risk of sunburn and photosensitivity. A study published in the Journal of Antimicrobial Chemotherapy in 2010 emphasized the heightened risk of photosensitivity associated with quinolone antibiotics. Dosages for these antibiotics vary depending on the specific antibiotic and the infection being treated. They are generally taken with or without food as directed by your healthcare provider. Dosing intervals typically involved once or twice daily administration. Common side effects include sun sensitivity, gastrointestinal issues, and the risk of tendinitis. Should you have any inquiries regarding your medication, we've crafted a dedicated book for your benefit. 10 questions everyone should ask their pharmacist. You can find the link in the description below. Feel free to explore it. 4. St. John's Wort. St. John's Wort is a herbal supplement often used for mood disorders and mild to moderate depression. It contains compounds that can increase skin sensitivity to sunlight. A study published in the Journal of Clinical Psychiatry in 2003 found that St. John's Wort could cause increased photosensitivity. Dosages for St. John's Wort can vary, but typically amounts range from 300 to 900 milligrams daily, divided into doses throughout the day. It is often taken with meals, and dosing intervals typically involve dividing the daily dose into 2 or 3 administrations. Common side effects encompass sunburn, skin rashes, gastrointestinal upset, and potential interactions with other medications. 3. Retinoids. Retinoids are employed to treat acne, fine lines, and skin texture irregularities. However, they can increase skin cell turnover, rendering the skin more susceptible to UV damage. A study in the Journal of the American Academy of Dermatology in 1998 confirmed the increased susceptibility of UV damage caused by retinoids. Dosages for retinoids vary depending on the specific retinoid and the condition they are treating. These medications are typically applied once daily in the evening, with protective sunscreen used during the day. Common side effects include increased sun sensitivity, skin dryness, and peeling. 2. Psychotropic medications. Certain psychotropic medications such as tricyclic antidepressants and phenothiazine antipsychotics can increase sun sensitivity, leading to an increased risk of overheating and sunburn. A 2011 study in the Journal of Clinical Psychopharmacology highlighted the potential risk of sunburn associated with these medications. Dosages for these psychotropic medications vary widely depending on the specific medication and the condition they are treating. These medications should be used as per the instructions of the healthcare provider. Common side effects include sun sensitivity, drowsiness, and other psychotropic side effects. 1. Certain antihistamines. Certain antihistamines, including hydroxyzine and promethazine, can increase skin sensitivity to sunlight, making you more vulnerable to sunburn. A study published in the Journal of Allergy and Clinical Immunology in 1998 found that antihistamines can increase the risk of sunburn. Dosages for these antihistamines can vary depending on the specific antihistamine and the condition they are treating. These medications should be used as per the instructions of the healthcare provider. Common side effects include sun sensitivity, drowsiness, and other antihistamine-related side effects. Understanding the impact of specific medications on your skin sensitivity to sunlight is paramount to safeguard your health and well-being. Consult your healthcare provider and carefully read medication labels to be informed about potential interactions with sunlight. When taking any of these medications, adopting protective measures such as wearing sunscreen, protective clothing, and sunglasses while avoiding excessive sun exposure during peak hours is essential. Prioritizing your health will allow you to safely enjoy the sunlight without compromising your well-being. Welcome to Dr. Vivian Medications and Natural Supplements. Our channel is dedicated to providing valuable information on health and wellness that's made by a licensed professional. Times are crazy, and it's extremely important to be well-informed and taking care of yourself. If you enjoyed watching, please help us out by liking this video. In this way, we will know how well we're doing. And if you like more of these, consider subscribing and hit the bell notification to stay on top for more upcoming videos. Thanks for watching.